We are just 3 months into 2013, but already the Crosse County Health Department is scrambling to figure out how to absorb major program cuts for next year. News 8's Pauline Lee joins us now in the studio with a closer look.
Wisconsin recently lost $1.2 million in federal funding for lead programs and another $300,000 for radon programs. As a result, these programs will no longer exist in La Crosse County, and that could have a negative impact on your health. Future operations for a couple of La Crosse County health programs are a little uncertain.
Anything can happen at this point.
The county's radon program lost its federal funding for 2014, and the county's environmental health manager Jim Steinhoff says that could have a big impact on the region.
Radon is a serious problem in this whole part of the state, and in La Crosse County, about 10% of the homes have 2.5 times the level that's considered acceptable by the EPA.
Funding helped the health department provide low-cost radon test kits and professional consultation to the public. Steinhoff says without these services, the number of people with lung cancer may rise.
We're looking at thousands of homes that should be repaired to reduce the risk of lung cancer.
Federal funding for the county's lead program will also likely disappear next year.
We work pretty close with families to kind of get into the home, see if we can figure out where the source of the lead is coming from, and give the family suggestions on how to fix it.
Weigel says the cuts could mean waiting longer to make house visits to children with lead poisoning.
Usually we'll go to a kiddo's home if they've been lead poisoned at 10 micrograms. We might have to start going when the level's 15.
Weigel says in the long run, lead poisoning could cause behavioral issues, affect a child's IQ, and has been linked to attention deficit disorder. And the longer Weigel has to wait before helping a child,
the more detrimental it could be to the child.
The health department urges people to maintain the paint in their homes. This issue is even more important in La Crosse County because so many of the homes are older and have a better chance of containing lead in the paint. As for radon, the best preventative measures is to get homes tested.
All right, thanks a lot, Pauline. Now, county health officials say they will spend the next several months working on a plan to deal with next year's funding cuts.